I was 69 when I underwent an operation for prostate cancer. It even came with a scary name, Robot Assisted Laparoscopic Prostatectomy. Yeah, that rolls off the tongue, doesn't it?
Of course it is not what you want to hear, and of course it's frightening. The unknown normally is, especially when it comes with the word cancer attached to it. But the reality is somewhat different.
Secondly, we really don't need to worry. The prostate surgery has been revolutionised by the use of the robot, and the outcomes are so much more superior than they used to be. We get patients back to normality much quicker, and the recovery is much faster.
The operation itself normally takes about 2 hours. Now, though it's called robot assisted, the surgeon is, of course, carrying out the operation, using state-of-the-art technology to control the arms of the robot, which stand above the patient. It is precise and far less invasive than old-style surgery. The arms of the robot are placed into the abdomen through small cuts, and the prostate is removed, together with seminal vesicles. Then the bladder and the urethra are stitched together. Now, I have to say that after my operation I was in very little pain, thankfully. I was back to doing my office work and walking around perfectly fine. That is my personal experience.
That said, it is important not to do too much too soon.
Our plea is no heavy lifting for around 6 to 8 weeks. That means nothing heavier than a full kettle. Reason behind that is just everything's still healing. Most people feel like they might be able to after about 2 to 3 weeks, but again, we plea that people do not do that at this point. And then from a driving point of view, until you feel you could safely do an emergency stop, which is usually around 6 weeks.
Post-surgery, there will of course be wounds, but they will be small because of the nature of robotic surgery. They're likely to be either glued or stitched, and you'll see nurses in the weeks after the operation to check the wound sites. When you come home, you will have a catheter fitted and you'll be given catheter bags like this. This end attaches to the catheter, this will strap to your leg, and then there is a valve at the bottom to empty the urine, and I'll show you now how that works.
Now, at night time, as well as your leg bag, you're going to need a bigger bag because obviously you're going to be passing a lot of urine and you don't want to be getting up every couple of hours. So you get a night bag like this. And what happens is that the night bag attaches to your leg bag like this. And remember to open the valve of the day bag so it can flow into the night bag. It's very important the night bag sits below your waist level. So if you imagine this is my bed, then the night bag is going to be down here somewhere. We came up with an idea of putting a bucket at the bottom of the bed and then attaching the night bag to a coat hanger.
There are, of course, side effects to prostate surgery, the most common being erectile dysfunction and a degree of urinary incontinence. How long that lasts varies from person to person, and in the case of erectile dysfunction, whether the neurovascular bundles were spared during surgery. Now, there are exercises that you can do to improve your pelvic muscles and help with incontinence. That is after your catheter has been removed, normally after about 10 days. It is extremely important, and I found this app extremely useful. Now, you are obviously going to need some time off work after your surgery, and that means you're going to need to talk to your GP about a not fit for work note. There are other side effects like blood in your urine, which on the face of it can be quite scary.
That's very common to see blood in the urine. That's part of the healing process. We have to join the bladder back to the urethra, and as that's healing, intermittently you'll see blood in the urine. That can happen any time between 6 and 8 weeks after the surgery. The thing to do is to just drink a bit more fluid to keep the urine a light colour, but if it ever gets dark red or there's any clots in the urine, then you need to seek medical advice. Get in touch with the team or the specialist nurse, because we want to make sure that the urine is able to drain and the catheter particularly is not blocked.
Moving forward, you'll have blood tests to check your PSA levels every 3 months, but not for 6 weeks after surgery. And that will be the case for the first 12 months. Then it's every 4 months in year 2 and 6 monthly in years 3 to 5. To sum up, surgery is one option for treating prostate cancer, and it has a great success rate. Yet there can be side effects, but none that medical teams haven't come across or can't treat. So I very much hope this film has helped and has been of some reassurance to you.